Okay, good evening, everybody. So my name is Imelda Williams. I'm the unit convener and the chief examiner for this unit. And with me, I have Tony Smith, and he is the sessional academic that really supports and assists me in delivering this unit.
Hi, everyone.
So before we start, I wish to acknowledge that Monash University recognizes that its Australian campuses are located on the unceded lands of the people of the Kulin Nations and pays its respects to their elders past and present. So the best way to get hold of us is via email. As I've already mentioned, Tony's a sessional, so he's not available during office hours always. And although I'm full-time, I also teach in other units. So please contact us via email. That's the best way for us to quickly respond to you. And this is just for students if they just use the PowerPoint presentation to log on. Okay, so I'm just going to stop share here and then go to the unit itself. Okay, so I'm quite sure that you would have worked through this unit already during the orientation period. If you haven't, I would really encourage you to do that. And I'm just going to go to, oh, sorry, let me just stop share. I've actually opened up the PowerPoint presentation and not the website. Okay, there we go. So under unit information, you will find the timetable. And if there's any changes to the timetable, I will update it and put the date that it's been updated, and then also normally post a notice. Use the timetable to put into your diary, especially things like assessments that's coming up when things are due, but also our catch-up sessions. There's only 2 for this unit after this one, because it's really good to attend those sessions, because you can ask questions of things you are unsure of, and sometimes other students might mention something that you haven't thought about. And then there's the assessment summary. And also, if you go to the library reading list, you will be able to access the ebooks that's available through the library and which you can have access to. So you don't need to buy the books. However, when we use those reading lists, we will actually indicate which pages in the book we're working for that specific week. There's also a link to the image interpretation workbook. And once again, if we refer to the book, we will refer to the pages, but you can actually download the whole image interpretation workbook. And then you will notice that under learning, you can only see until week 1. We release the material on a week-by-week basis, and we try to release it on a Friday prior to the start of the next week, because we know that some students prefer to do their work over the weekend. The next one is the assessment tab, which is really important. So here you will see there's 3 assessments that needs to be completed for the unit, and it also shows the dates that these assessments will be taking place. And we will talk a bit more about that. I just wanted to show under written. So this is an ISAP case, and next week I will introduce the ISAP case in more detail. However, you can see under the assessment tab, you can see the drop boxes are there for the CAP report. There's also a link to an expert report, and then also the comparative report. And then under exam, you will be able to see it's a competency hurdle and also the dates when it's going to take place and which weeks will be assessed. And then also information about the clinical portfolio. So you can click on all of those so that you can see more. The other tab, which is quite useful, is the forum tab. Myself and Tony, we use that tab to post announcements. So you will receive weekly announcements, tends to be on a Friday when we send that. But then there's also an opportunity for students to also submit to the forum. So if you have any queries, please use the forum as well, especially if you think it's something that might benefit the other students. And then under,
Imelda, I'll just interrupt. I'm
yeah,
not sure whether you've noticed, but Helena and Joanna have both joined us, or Joanne, sorry, have
no,
both joined us as well.
okay.
So,
Okay,
so
welcome.
yeah.
Okay, thanks for that, Tony. No, because I don't have the
Yeah.
viewing open, but welcome to Joanne and Helena. I will, once I'm finished with this, I will speak to you quickly. Then the other then is under the support button, where there's all of the support that you can get from Monash. And the key one that I want to highlight here is a short extension and special consideration. With short extension, you can apply for a 2-day short extension without having to provide any specific documentation. Just be mindful that if, for example, with the ISAP case, that's due on a Friday evening at 5 to 12, the extension has a maximum of 48 hours. So you then need to submit your report on the Sunday evening. So the weekends are counted in the short extension. If you need more time, then you must apply for the special consideration, and for that you will need supporting documentations. Okay, so that's the main things I wanted to mention there, and stop share and say hello to Helena and Joanne. Nice to see you again, Joanne. Yeah, so Joanne
Hi,
has
everyone.
also come back. This is now your final semester to complete your work. So welcome back. And Helena has joined us as well. Helena, I just want to check, are you just enrolled in 2 units this semester?
Yeah, just two, 5108 and 5109.
So you haven't done 4502 yet, hey?
45, no, no, not
Okay.
yet. I've only done the map 5003.
Oh, okay. All right. Okay, no, good. Okay, I've just told Shangari, because we have got students that's only enrolled in this unit, I have to explain in detail what the unit is about, like I did last night. So it might sound a bit repetitive for you guys, eh? All right, so I'm going to go back to the unit introduction and just share that again. Okay, so I've also given a link here to the I've given a link to the course itself, to the handbook, so that you can have an idea of the overview of the course itself and where this unit sits within the course. And then on the next slide, I've got the link to RAD5109, to the handbook as well. So you'll be able to see the learning outcomes there. The handbook, of course, includes more than just the learning outcomes. You'll be able to also see the assessments as well. So please feel free to click on those links so that you ensure that you understand completely how 5109 sits within the course. Now, all of the resources will be on the Moodle site. As already mentioned, the timetable is available there, and we release material on a week-by-week basis. The image interpretation manual you can download, of course, but we will refer to specific pages in the book. And all of the majority of the materials that we present as a Moodle book. And in that Moodle book, you will normally have specific learning outcomes for that week that needs to be achieved. So that's different than the unit learning outcomes. And then also some supporting resources such as a PowerPoint presentation that you'll see, but also links to ebooks and journal articles and so forth. And then, of course, there is the reading list. Now, apart from tonight, there's two what we call catch-up tutorials, which will occur on the 23rd of September, and the other one will be on the 22nd of October. Now, these catch-up tutorials are basically there for students, so that if you have got any queries, that you can ask us about those queries, but we also can explain more about the other things like the assessments that you need to submit. By that time, you would have submitted, for example, already the ISAP case, and a formative test will be done in that same week. So if you've done the formative test before we meet on the Tuesday, you're welcome to ask any questions about that. The second catch-up tutorial is in the last week of the academic period, and that's really to focus very much on the upcoming exam, because that exam covers all of the material that we've done during this semester, as well as also information about the clinical portfolio. Now, although you only write the exams in the week of the 22nd of October, I'll give two formative tests. So short of halfway through, then that will be in the week of the 22nd of September, and then also in the week of the 20th of October. And I would really strongly encourage you to undertake those formative tests. I give video recorded feedback to those tests, and then also review the feedback. And if you have any questions about the formative test, please feel free to contact either myself or Tony. Throughout the course, we use image manipulation software, and we use it in the ISAP cases, in the formative test, as well as in the final exam. And I've given a demonstration of the software. For the final exam, you will need specific login details to access the software during the exam. Okay, Tony, you can take over here.
Thanks, Imelda. I might just quickly comment that I think you're, are you sharing the PDF version of the PowerPoint rather than the PowerPoint itself? Because I think some of your highlightings are not there, but
showing.
that's okay.
Okay.
Yeah. Did you want to change it, or?
I can if you want to. Let me
Oh
just
no,
stop
I
sharing.
don't think it matters too much, but
I was sure it's no. I haven't got the PDF. It's the PowerPoint that
oh,
I have.
okay. So it is the PowerPoint. Okay, so
Yeah, I'll just
I
reshare.
seem to remember there were some bits that were highlighted in red that yeah, are not showing up. But anyway, that's okay.
Okay, so let me just quickly reshare again. It's definitely the PowerPoint that I have in front of me.
Maybe it might be me that's
Yeah,
losing
no. It's definitely not the
losing the
PDF because
highlighting.
yeah.
Yep. Okay. Now this is again, as Imelda said, I'm repeating myself from what I said in relation to 5108, but external online resources are really welcome for you to use, and there's a lot out there. There's many sources that you can actually access online. And one of them you might not be aware of is called Collective Minds Radiology, which has been put together by radiographers and radiologists and other specialist medical officers as well. And the idea of it is that people actually post cases, and then anybody who's a user can actually go on and interpret those cases and put it forward an opinion. Now, if you join Collective Minds Radiology, which you can do by using that link that's shown there, and it's free. Not many things these days are free, but this is. So you can actually go on there and you can actually look for cases that are relevant to this particular unit or other units that you may be doing. And obviously, I guess with radiology being what it is these days, there's a lot of MRI on the site. There's also CT and ultrasound. But there's also general radiography, and you'll see that there's a drop-down menu where you can actually choose general radiography, or you'll also find it in other anatomic specific locations on those drop-down menus. So have a bit of a browse around and find out what you can see, and then you can actually look for appropriate cases, and you can have a go, see whether what your confidence is in actually having a go at interpreting some of those cases. And some of them are quite challenging. Many of them are quite challenging, and some of them are less so, and are more common types of pathologies that we might see. But it's a useful means to actually just test yourself and then get some feedback, because other people will also have attempted the same cases, and then you'll be able to see what they've said, and you'll be able to compare your opinion with others. There's a sample link to a sample case there. Now, as I said, there's a lot of online resources out there, and I advocate the use of those. Don't feel shy about that. Obviously, one of the ones that I strongly advocate is Radiopedia, which is a very good learning tool, and again is put together by radiologists and radiographers. And I recommend that and link to it in quite a number of the slides that I put together. So it's used as a reference, and I encourage you to use it as a reference as well, but just make sure that you reference it properly when you do. The one that's actually down the bottom of the slide there, Dr. Ian Cowan, it's IC X-rays, or Ian Cowan X-rays. This was actually, Ian Cowan is a New Zealand radiologist, and I did some work with him, as did some other radiographers, in teaching radiographers in developing countries, like the Pacific Islands, Africa, and Southeast Asia, to interpret radiographs in locations and circumstances where there's no radiologist available. So the idea of that website is to, as it says there, support radiographers who interpret X-rays in developing countries. So that it's aimed at radiographers, and it's a really useful tool, really useful learning tool. So I'd recommend that you actually go on and have a look at that. In fact, you'll even see some of the slides that have been used in this course as well, with Ian's permission, of course, and slides that actually I used when I was teaching in this course as well. Teaching in that course, I mean, not this course, but I teach in this course now. So it's quite a useful adjunct to your learning. So it doesn't have voiceover with the material, but you can scroll through the lecture material, and it's actually quite good. I'm going to leave it there, Imelda. Thanks for that.
Okay, thank you, Tony. Now, this slide captures the 3 assessments, and you will see there's the ISAP case, which has a weighting of 30%, and it has 2 parts. There's the CAP report, and then we've also got a week later the comparative report as well. And you can see that it's on a Friday evening at 5 to 12 in the evening. So once you submit your CAP report, your clinical action plan report, at 12 o'clock that evening, the expert report will become available, and then you provide a comparative report. The online exam is the biggest weighting. We cover all of the materials that's being taught during this whole of semester. So it's a really big exam, and that will be Thursday, the 6th of November, and that falls in the first week of the final exam period for the university. The third task is the clinical portfolio, and that deadline is in the last week of the the exam period. And please review the material that we make available during this week because it helps you when you put together your clinical portfolio. You will also notice that both the online exam and the clinical portfolio are competency hurdles. And what that means is you need to pass both of those exams at a minimum of 50%. If you fail it at the first time, you'll get an additional opportunity to resit either the exam or to resubmit your clinical portfolio, but that will then be capped at 50%. The ISAP case doesn't have a competency hurdle, but the weighting is 30% is a significant weighting for the unit. So please ensure that you do your best also with the ISAP case. So the university is very strong on academic integrity. I assume that most of you will not receive an email to say you need to complete a compulsory module because you would have completed in some of your first modules as well. But if you do, please ensure that you do complete the compulsory module. If you don't, you will receive an email with a warning that if you don't complete it by a certain time, that you will lose your access to the Moodle site, and that can happen. And then it is really difficult to restore you back again. Now, generative AI is, of course, the big topic nowadays. So on the support tab on the Moodle site, there's a tab that shows Learn HQ. So you can read more about how the university addresses artificial intelligence. So I'm not going to spend too much time about that. So please read through that. And then I've already mentioned about the special considerations that you need to submit. Now, I don't manage any of the special considerations, whether it's a 2-day short extension or the formal extension. We've got a team, the SpecCon team, that does that. It is really useful that if you have applied for special consideration, just to let me know, because sometimes they might take a bit long than what they should, because they, of course, look at the whole of the university, just so that I'm aware that you did submit an extension. So with the ISAP case then, for those who is undertaking an ISAP case for the first time, ISAP stands for Integrating Science and Practice, and this ISAP case will cover an ankle case. So in the ISAP case, and during next week where you'll receive the information, there's a Moodle book dedicated to the ISAP case. And in that Moodle book, you will find the clinical scenario, you will find supporting images as well as access to the image manipulation software. And then you will also find a list of professional issues that you need to address, and that you write up as your clinical action plan. And then once you submit your clinical action plan, you will then receive the expert's report, but you will only receive the expert's report if you have submitted your CAP report, and also only if the deadline has been reached. So you won't receive the expert report before the 6th of September early morning. And then you need to compare and contrast then your CAP report with that of the expert report, and then write up a comparative report. The overall word count for the ISAP case is 2,000 words, but the majority of that is towards the CAP report. So that's a bigger weighting. It's 1,500 words. And then the comparative report is 500 words. Now there's a 10% leeway, which means that you can have 10% more or 10% less than the required word count, but please don't go over it, because some students just really tend to go way over, and then you will get penalized for that. The other thing to be aware is that when you submit those reports, it will go automatically into a Turnitin matching software, and that is to detect if there's any plagiarism undertaken by the student. And it's really important that when you use resources to write it in your own words. Normally I say to the students, the university has a cap of 15%. You get a similarity index, so greater than 15% flags it. But when we then mark it, we go into the Turnitin report to see if there's true plagiarism. Quite often it will pick up students. Some students tend to actually copy the requirements that they need to do, the professional issues that they need to address, and that will match it up 100%, so that will increase your similarity index. The other thing to remember is ensure that your reports are in a final version, because as postgrad students, you're only allowed one submission. So you can't submit and then decide, oh, I've got, for example, if you think about similarity index is greater than 15, I'm going to try and tweak again. So it only allows you one submission. And then the other important thing is that because we really need for you to demonstrate your knowledge and skills, AI is not recommended for this assessment task. And there's the submission dates. The online exam, so all of the resources will sit within the Moodle book. So all the materials that we covered during weeks 3, 4, 5, 7, 8, 9, and 11. So in week 2, we just focus mostly on the ISAP case. And then you will notice that week 6 is not listed there. And the reason why week 6 is not listed is because that's the week where you need to submit your CAP report. So we don't want to give new material because you really need to focus on submitting that CAP report. Now, I already mentioned that there will be 2 formative tests. And these formative tests is to assist you in preparing for the final exam. So in that test, there's the questions that's posed are mirror what we can expect in the exam. So those questions can include multiple choice question, but also essay style, where you need to provide a comment about a case that we've given in the exam. For the formative tests, I usually provide video recorded feedback, but feel free to contact me if you are uncertain about some of the feedback that I've given. And sometimes you might think, isn't this something that Imelda's missed? Please feel free to contact me. So the exams are taken wholly online. It's open for 12 hours. So from 8 a.m. to 8 p.m., you can undertake the exam, but ensure that if you start late with the exam, you must be finished by 8 p.m. because the exam will close at 8 p.m., irrespective of whether you have finished the exam. Also be aware that once you start the exam, you've got to complete the exam. Now, during the exam, you will have access to the image manipulation software, and those details sits within the exam itself. Now, you will notice that the exam is quite long. It's 100 minutes. And I would really encourage you to try and take, if you can't take the whole day off, to maybe take off half a day so that you can really be in a good space when you start the exam and allow yourself to be relaxed during that time, so that you're not stressed. You just come out of from work or something and must quickly try and finish that exam. Now, because the exam runs until 8 p.m., the team at Monash doesn't support monitoring the students during that time. So I'm the one who's actually responsible for monitoring and what happens with this exam. So please note that I always ask for students to send me their suggested start time. And once they've sent me that, I will then email to you and to your students' account only the login details, which will be for the exam itself and then also for the image manipulation software. It's really important for myself to know more or less when students are writing so that I can be at the computer in case you run into any issues. And I always say to the students, if you find, for example, that your internet has dropped off or the images are downloading very slowly, to contact me. I give my number because I can extend the exam for you should you have experienced any problems. And then the clinical portfolio, which I won't talk too much about it now because I'm going to go through the presentation as well that I've submitted, but there's also a video recording for the clinical portfolio itself. So I'm going to skip the slide and then address it once we're busy with the clinical portfolio. And that as well. And this is just an example of what the case reports should look like. So your clinical portfolio has got two requirements. So the one is compiling a 25 case portfolio. And then the second part is where you do a self-auditing of your work and work out stats for that. Okay, so I'm just going to stop share. And before I go on to the clinical portfolio, are there any questions about what I've just discussed with the assessments? And I think also for the new students, whether you have thought of stuff maybe from last night that you want to ask tonight, like Helena, for example?
That's perfect timing. I do have a couple of questions actually in regards to the formative tests. Will we be notified during the week of learning when those tests will open and how long are they open for?
Normally, as I mentioned, we open the week on the Friday, so you will have, so if the test is, for example, the first one is starting the week of the 22nd of September. So we normally make it available from the Friday before that. So you've got that whole time to do it. You can do it whenever you want to. I normally provide the feedback, the video recorded feedback towards the end of the week. And that is to give students enough time so that they can actually work through the formative test and then review the feedback. So you use that feedback to self-mark your test. But there are some questions, of course, where you have to provide essay style comments. If you want me, if you're unsure, you can always say to me, can I go in and actually go and mark? I don't mark the exam physically, but if students want me to go in, I will do that. You can always let me know. Now, as I mentioned, in that same week, we have the catch-up tutorial on the Tuesday. That's when the formative test takes place. So it would be actually good if you could do it before we meet on that Tuesday. So if you've got any questions, we could address it then.
Yeah, brilliant. And just to double check, are these formative tests graded or are they just for us to help prepare for the finals? Yeah,
No, they're not great. You will not get full marks for that because the essay style questions are not require someone to go in and physically mark, but like the MCQs and if there's any matching question or those kind of questions, you will get marks. But if you want me to do it, and I can go in and mark your exam if it will help you. I don't normally do it, but students feel free to ask me to go in and mark your exam if it will help you.
Yeah, brilliant. Thank you.
Anything else, Helene? Is that it?
For the moment, yeah.
For the moment.
That's what I got. Yeah.
Joanne, we haven't spoken much to you. Have you got any questions for us?
I'm okay so far. Thank you.
Okay, you're still at work tonight?
Yes.
I can see, yeah. And Shangari, any questions?
No, I'm good. Thanks.
All right. Okay. So I'm going to now just go over the clinical portfolio. So let's quickly do that one. Okay, so I'm just going to go to the relevant material there. So I've posted all of the clinical portfolio material under this week. There's a Moodle book for that, and I've also done a video recording as an introduction as well. And in the Moodle book, you will also have additional Word documents to assist you in completing the clinical portfolio, because there's two parts to it, and then also I'll also included the rubric as to how we mark the clinical portfolio. So when you complete your cases, of course, you will be using some of the information that you've learned through this delivery of this unit. So some of the other Moodle books will be applicable as well. And as mentioned, the clinical portfolio is a competency hurdle. It has a weighting of 30%. And there's two parts. The one is where you need to submit a minimum of 25 clinical cases specific to this unit. And this unit, of course, covers the pelvis and lower limbs, and then the thoracic and lumbar spine, and only X-ray cases, of course. And then the second part is the self-auditing preliminary image evaluation record, and I'll talk a little bit about that. And the submission deadline, although it's only in November, you can already start slowly collecting cases so that you have enough cases and writing them up slowly so that you are not under pressure when you have to submit the portfolio. So for your clinical cases then, it's marked out of 100, so each case is worth 4 marks. The overall word count is 2,000 words, but some of your cases, and so more or less 80 words per case, but some of your cases will be less, some of them will be more. I always say to the students, don't stress too much about that. And then, of course, as mentioned, the range of body areas that's covered in this unit, so only those are included. But what's really important is that you must include normal cases as well as abnormal cases, because it can be very difficult with the normal cases. When you see a case, you expected something to be wrong, and that's one area where students tend to overcall. And of course, when you work out your statistics, the specificity, if you've got very few normal cases, can be very low if you have overcalled on cases. And then include a short clinical signs and symptoms, maybe mechanism of injury. You have to include at least one de-identified image. If there's more, you can add more images as well. And then write up your preliminary image evaluation, and do that without looking at the radiologist's report, because that's how you're actually going to learn. And then once you've written up your PIE, you then compare that to the radiologist's report. Now, remember, the radiologist's reports sometimes have got more information than what's required. So if it's a trauma case, they might have information about some chronic stuff like arthritis. You can ignore that, but then you only need to focus on what's really going to answer the clinical question. But there might also be some incidental findings, not related to trauma, but for example, if it's a pathological injury, that you need to also include that as well. Now, it's not necessary, but if you want to discuss the patient immediate management, you can include that. And also, especially if you've got a really interesting case and you want to add some references, you could do the same as well, but it's not required that you must have references. So this is the marking rubric. So clinical symptoms. And then when you write up your PIE, use the ABC search strategy, but you don't need to report on each of those ABC criteria. So for example, if it's just a dislocation and there's no bony injuries, then you only need to write about, for example, the cartilage and joints and alignment because of displacement. And then with your PIE, of course, I've already mentioned you need to compare that to the radiologist's report, and you must include and ensure that you include only de-identified images. I've given this example as a write-up. Please ensure that you number each of your cases consecutively. If you have a case where, for example, the patient was referred for an ankle and a foot, and you want to write it as separate cases, because students really struggle to then work out their auditing findings. And then in this case, the PIE report stated there's a Salter-Harris type 4 fracture, and the radiologist's report was mainly consistent. However, the radiographer incorrectly identified that there was a medial malleolus fracture, and that it was, and the radiologist mentioned it's a Salter-Harris type 3. So when you work out your result for each of the cases, so in this case, the true positive, so the majority was matched, and that was 0.67, and then false positive was 0.33. If you add it up, it must all add up to 1. The second part is the self-auditing record. So you will have a table with all of your 25 cases and covering all of those body regions, and of course have normal and abnormal cases. And I've already mentioned you must address the clinical question, and then you assign whether it's a true positive, a true negative, false positive, or false negative. So you might have to use fractions. So, for example, if there's 2 fractures and you've only identified 1, it means you've only identified half of the pathology. So you'll assign half of a true positive and half of false negative. And then the second part is where you calculate your sensitivity and specificity and your overall accuracy. So sensitivity looks at how well you are at identifying pathology. Specificity is how well you are at identifying that the case is normal. And then you need to write a brief reflection on your preliminary image evaluations. And in that you can write, that you feel really confident now about certain body regions, for example, or identifying certain types of pathologies, but there might be areas where you feel that you still need to do some more work on. And this is just a summary of how you allocate that. And this is the spreadsheet that you need to submit, and you will add more rows for your cases. So for each case, if you read across here, this must add up to 1. And then once you've had your 25 cases, if you add up all your true positive, true negative, false positive, and false negative, that last row must add up to a total of 25 cases. If you want to add more cases than 25, you're welcome to do that. However, please don't go too overboard with adding more cases. And this is the decision-making timetable where it compares the radiologist's report, which is seen as the gold standard, against that of the PIE report. And in the top, you have got the true positive and a false positive. And then at the bottom half, you've got false negative and true negative. So as mentioned, sensitivity indicates how well you are at identifying pathology, and you want to keep that as close as possible to 100% and have very few false positives. And there is the formula, of course, to work out sensitivity. And specificity identifies the normals and how well you are at discriminating that there's no pathology, and you want to have as few as possible false positives. Remember, if you work in an area where there isn't an on-site radiologist, quite often the referring physician, or you might work with other staff members that might come and ask your opinion. So if you have a very high false positive rates, it can actually have the risk of unnecessary imaging, additional imaging or treatment that can occur. And the accuracy is in the ratio of your true positive and true negative. So it gives an overall statistics of how well you are overall in identifying image interpretation, X-ray image interpretation cases and abnormalities and normalities. So then in summary, the main thing that I really want to highlight is to include normal cases. Students often forget that. They're so focused on their abnormal cases. And then also the other thing is if you have a case that you are unsure about as to how you need to write it up or assign your true positive or false negative, please contact us so that we can support you. And then that is the deadline for the clinical portfolio. Okay, so I'm going to stop share now and then just ask if there's any question. Shangari, looks like you're ready to ask a question.
No, I've already had my questions answered.
Okay, all right. So just remember, if there's any, so with the body regions that you have to cover for this unit, are you sure you will get all of those body regions covered?
I have a question. Okay, there was this just now you were explaining about the different body regions where we have to put 25 cases. Do we need to put the number case number 1 accordingly? The body region or
so if you identify a case, you don't have to write it up, say for example, all your pelvis cases together. So it can be mix and match. It's just that the reason why I say you need to put at the top which case you are referring to, because I also need to match it with your case reports and then also when you do your auditing record as well. If the numbers are not there, I really struggle, when that table is there, which case are you actually referring to? So you have to write the number. So from 1 to 25 in the order that you have it in your when you submit your 25 cases. Yeah.
And don't use accession numbers or medical record numbers or anything, Shankari. Just give them a new number of your own, 1, 2, 3, 4, etc. Or you might prefer some other way of numbering them. But so long as everything links together, including the images that you include. So you're going to have to save your JPEG images as having the same ID number, but not the accession number and not the unit record number, which would be inappropriate, unethical to do that.
Okay.
All right.
Okay, thanks.
Joanne, any questions from you? I know you've now been through, at the last stage. Have you got any questions with the clinical portfolio?
I'm just wondering whether you prefer cases from the ED, emergency department.
No, so some of you might actually work in areas where you don't get a lot of trauma cases and might have more patients that have more common pathologies. And I know one of the students really worked in it where there was lots of elderly patients. So there was more chronic conditions. So you can include chronic conditions, but we would of course also like to see some emergency cases as well, but you can include a range of conditions.
Okay.
Anything else,
Thank you.
Joanne?
No.
No, you're good.
Joanne, have you got any advice for people having sort of been through this process partly before? Was there anything that maybe floored you or made you uncomfortable or anything that we might be able to help people get around? No?
Basically, I think we just have to start collecting early.
Early, yeah.
Yeah,
That's a good point.
I started about 2 months before the deadline. So yeah, but I was still rushing at the end, trying to organize everything together. So the weekend before the submission day, I was just doing that.
The write-up.
And tell everyone, do this to me. I need to do this.
That's good advice, though. Don't wait. And the other piece of advice I had is just in terms of actually making sure you include some normals, and do not just concentrate on cases that display pathology in cases that you are very comfortable with, maybe, find some way to randomize cases a little bit, like choose a particular time period and choose all the relevant cases in that time period or something like that. And they don't have to be cases that you actually, cases that you have radiographed yourself. So you can actually go back into the packs and choose archived cases over a particular period of time. And that way you'll have a bit of a mix of normal and abnormal and easy and hard and, various other combinations. But the trick, of course, is to actually try to keep your, keep the variety of examination types that you need to cover for this particular unit, which is, lower limb, pelvis, lumbar and thoracic spine. Yeah.
Yeah,
And if
not so many thoracic spine.
Yeah, so you can use archived images, so they should have been in your archive, in your PAC system. You might find archived images as well. So as Tony mentioned, it's not cases that you need to have x-rayed, but if you really do struggle to find a certain body region, so say, for example, you can't find any thoracic spines, just contact us before submission, and so that we are aware that you're having an issue.
It is nice to have some trauma cases, and I think in probably all three of you, and hopefully the other students as well, will be able to find trauma cases. Yeah, so.
Okay.
But non-trauma stuff is good. So,
yeah.
Don't want to actually just be too specific.
Helena, any further questions from you now that we've gone over the portfolio again?
No, I'm pretty good at the moment. I actually started looking at my PAC system anyway, like about a week ago, and just started compiling what I wanted. So yeah, it's definitely good to get a head start.
Very, very sensible.
Yeah, it's good to be very well organized, because I know some of you have got family, that you need to look after when you get home. It's not just yourself always. So, if you start earlier on, it just makes it much more easier when it gets to the deadline, even with the exams as well. Making sure that every week's material that we release, that you actually work through those material. Doesn't mean you have to do. Sometimes the week can be just crazy for you guys, but make sure that you catch up as soon as you can, because you don't want to really struggle when it gets to exam. There is so much catch up that you need to do. And as always, as we say, if you've got any questions, or if you're struggling, because students start a course, and they think everything's going to go well, and I'm going to enjoy the course and I'm going to be brilliant, and then something happens, so that's maybe when you have to apply for SpecCon, but also contact us, if you are struggling. We can have a conversation and see how we can support you.
I got a question for you guys. I was just thinking about it today, and I like to use black backgrounds on slides that have got images on them in particular, because they project better, and on your monitor they look better if they've got a black background, like a radiograph does. And the difficulty, I guess, is when you guys might want to print them out, they can use a fair bit of ink. So do you change them over to, or would you change them over to grayscale yourself? Or would I be better off to actually go back and save them all as grayscale, print them as PDF grayscale images, so that they then come out with a white background? Which, I mean, does it worry you that they're on a black background?
Personally, for me, not so much. When you say printing, is it for like one of our assessments that we need to print everything out?
No,
you
don't need to print anything, really. You don't need to print. I mean, so long as you save them, on your computer, you can save the files, and then you can go back and look through them in the PDF format. You don't really need to print them, but I know students being students, some of them actually, do like to create a folder and
write and scratch on it and highlight stuff, and
that's right. You want to scribble on it yourself, or or whatever, but
It's not
yeah,
necessary to print.
Okay.
I
Yeah.
don't know. I might
Because you
not
can
get out of
highlight
it.
on your computer as well. So
Of
yeah,
course you can.
let's
Yeah.
save the trees.
Yeah, I might save myself some work in actually going back and having to resave cases. Well, you've come across some of my slide presentations before, Helena, and if it didn't cause you any pain in the past, then
Yeah, it's fine.
maybe that's okay. Yeah, cool. Okay.
Actually, I do have a question. Oh bugger, where'd it go? Oh, sorry. I think I've lost the question. Sorry, I'll come back soon.
Oh no.
Listen, if
Well,
you remember afterwards, just email us.
Yeah,
Okay, so
yeah.
if you
It's never too late. It's never too late. Remember
Oh,
that you can
sorry.
email us, you can contact us anytime. We're friendly and we will respond quite quickly.
Okay, thank you. Sorry. It's just like I had it. No, I don't.
It's gone.
you're too young to have senior moments like us.
Gosh, I thought I was the only one having those moments, actually, Helena. And you got a much younger brain than me, so.
I'm
Yeah.
gonna get my brain scanned. That's what's happened to me. It's just the radiation got to the head.
It also happens when your brain gets too full, starts to overflow.
Yeah.
That too, yeah.
Okay, so is there no other questions? Because then what I will do is I will, of course, as per usual, I will post this recording on the Moodle site if you want to go back over anything. And if you have any questions, like Helena that can't remember, please feel free to always contact us. So it's last call, Shangari. Any questions? You good?
I'm good, thanks.
Joanne? Good. And Elena, I assume by now you're good, unless you remembered your question.
I'll probably email it to you guys a little later. Sorry.
You'll
Okay.
probably wake up about 1 o'clock in the morning and remember it. So write it down if you do.
Yeah, I will.
Tony, anything from you before I say goodbye?
No, can I just hang on to you for just a sec?
Yeah.
Imelda, with these, but you guys can go if you want. So.
All right. So I'm just going to stop the recording.